Hello everyone, my name is Sherifat Absalam. I have my badge on. I'm here today to perform colostomy care. I've gathered my equipment. I have clean gloves, I have the stomach paste, I have washcloth to clean the stomach area. I have a bowl with liquid, warm water, or maybe the prescribed solution from the provider. And then I have the stomach guide. This has already been pre-cut because I had to set up on the patient the colostomy bag and the stomach base right before we start this procedure. And then I have hand sanitizer for in between hand hygiene. I also have a washcloth set aside in case there is any leakage or seeping. I can place that under the patient to catch whatever is leaking from the bag. So I'm going to perform hand hygiene, go into the patient's room, provide privacy, identify the patient 2 ways with their name and their wristband, introduce myself to the patient, explain the procedure, and then seek their consent. Once the patient is comfortable with the procedure, I'm going to wear my gloves. Prior to that, I'm also going to place the patient in a comfortable position in preparation for the care of the colostomy bag. So once I've worn my gloves, I'm going to first of all check if there's any leakage, any seeping from the bag. I'm going to check. Once I establish there is none, like I mentioned, if there is, I'll place a towel or cloth right under the patient to catch whatever is leaking. I'm going to check and make sure the colostomy bag, especially the base, is still on the patient. Once that is there, Miss Smith, I'm going to take off the bag first. If you feel uncomfortable, please let me know. So the colostomy bag usually have a clip around it, so you're gonna use that and lift it away from the base. So once you have that, you take off the bag. You're going to check the content. If it's solid waste, you're just going to flush it into the toilet. If it's liquid, you want to measure it and document. And then because I'm going to reuse the bag, normally I'm supposed to dispose, but because I'm going to reuse it, I'm going to set it aside in preparation for the reinstallation of the bag. Then I have the base with me. For the base, I'm going to, because it has adhesive, I'm going to pull away from the skin towards the stomach. Miss Smith, if you feel any discomfort, burning or pinching, please let me know. I'm about to take off the adhesive on your skin. So that one, I'm going to pull away from the skin gently towards the stomach. And once I've removed everything around, I'm going to gently lift it off the stomach. So once I lift it off the stomach, I'm going to dispose. But because I'm going to reuse this, I'm going to set it aside for use. Before I clean, I want to check the skin. I want to make sure there is no tearing, there is no redness, no swelling, no bleeding. I want to make sure. And if there is any bleeding in between, the procedure, especially when I start cleaning, it's understandable because of the little friction that is on the stomach. But if it's excessive bleeding, I'll have to stop the procedure and notify the provider. Once I see that the skin integrity is intact, excuse me, I'm going to use the liquid that the provider has prescribed or a warm water as prescribed. I'm going to clean the stomach area, and I'm going to do it round the stomach area, inside out. Round, inside out. Round, inside out. Dispose that one. Get a second washcloth. That one I'm going to use to pat dry. Same way, round, inside out. Inside out. Round, inside out. And then dispose. Once again, I'm going to check, assess the area again, make sure the skin integrity is intact, there's no tearing, no bleeding, no swelling. Once that is done, I'm going to take off this glove, dispose it. Then I'm going to take another, I'm going to perform hand hygiene and then wear another glove. Once the other glove is worn, I'm going to use that opportunity to ensure that the skin is dry. Once it is dry, I'm going to take the stoma guide and I'm going to measure. This is already pre-cut. What we'll have applied is to use this, measure the stoma. Once I'm able to measure the stoma, I'm going to use a Sharpie around it. I'm going to take the base, place this stoma guide over the base, and use the Sharpie to measure it. Once I measure it, I'll get the scissors and then cut this out. All that process has been done prior to starting this procedure, and this is how it will be. So once the stoma guide has been used, I'm going to take it away. Then I'm going to use the stoma paste. The stoma paste will go around the stoma and then place that one down. Normally, I'm supposed to take the adhesive protector out of the stoma base, but because of possible remediation, I'm going to save that. And then I'm going to place the stoma base gently over the stoma. Press down around it and make sure I push away any bubble, any hair that might be on the skin. Push it away, press it firmly and gently. Once that is done, I'm going to take the bag. Before I put it in, I want to push out any hair and then secure the bag. The bag has a clip, so you want to make sure the clip is over the bag and it clicks. So gently, Miss Smith, I'm going to place the bag over you. There might be a little pressure on your skin. It's just because I want you to fasten properly. So make sure you place the bag right over the stoma and on the stoma base, and then click. Once you hear that click, that means you're doing the right thing. Once it's clicked in, you have secured the bag. Make sure at that point you check that is well secure. There is no space in between. You use the opportunity as well to check the stoma base that is fastened on the skin. There is no excess here, no lifting, and then make sure the bag is well secured. After this, I have completed my colostomy care on the patient. Are you okay, Miss Smith? Do you feel comfortable? If the patient says they're okay, I'm going to then take off the glove. Before that, I'm going to gather all the soiled equipment, put them in the proper disposable bag. I'm going to take off my glove. Perform another hand hygiene. Place the patient bed back into a comfortable position. Give them the call light. Let me know if you need any assistance, if you need any help. Use your call light. I'll be back to check on you as soon as I finish my documentation. At this point, perform hand hygiene, leave the patient's room, provide privacy, and then document. Thank you.